feels like a lot of people hit a wall when 2021 arrived, just like we all want it to be over. Can you talk a little bit about where we are and the effects of a year dealing with the stresses of this pandemic?
Sure. I think a year ago, everybody was thinking, "Oh, this isn't going to be such a long-term event," but it certainly has become that. And right now, I think we've got our feet in two different worlds, so to speak. We've got one foot in the pandemic world in which we've been living for the last year, but we've got that other foot in the, are we finally seeing light at the end of the tunnel as the vaccine is rolling out? So we are straddling, in some ways, two worlds. Children are definitely trying to figure out where they fit in this world. And we've had multiple other events happening at the same time. So there's been an intersectionality of COVID-19 and all that comes with COVID, as well as the social injustice movement, racism and healthcare disparities that have been brought into focus. So we're dealing with multiple issues all happening at the very same time, and our children are truly trying to figure out where they fit.
Absolutely, thank you. There's certainly lots more to talk about there. Professor Gsman-Pines, I'd like to move on to you for a moment. You were surveying parents working in the retail, food and service industries before the pandemic, and after COVID-19 arrived, you gathered information on how the pandemic was affecting those families and how they were coping. What do your most recent findings tell you about how the situation has changed for the participants of that survey?
Thank you so much. We have been back in the field throughout the fall with another survey of our large sample of parents who, before the pandemic, were all working in the service sector, as you mentioned. What we did this fall is we actually asked them to answer survey questions every day for a whole month. So we have a very detailed look at what these families' daily lives are like. And I think there are a few really important findings. One is that although employment has increased slightly since the worst of the unemployment crisis associated with this pandemic, we also see that just over 10% of the parents in our sample have actually dropped out of the labor force. And that is largely being driven by the needs of caring for young children and overseeing remote schooling. So this study was in Philadelphia, in a city where the public schools have been all remote. And so the first big finding is that parents, largely mothers, have had to leave the workforce in order to oversee remote schooling. What we're also seeing is that school and care has been very likely to be disrupted throughout the fall in a variety of ways. Could be that your internet goes out and so your child can't log into school. It could be that you're using in-person care for a young child and that care has to close because there's been an exposure at that site. But we're finding that on any given day, about 25% of families are saying school and care did not go the way that we thought it would today. And that is a very high level of disruption in families' daily routines. And finally, what that means for families is that on days when school and care has been disrupted, everyone is feeling a lot worse. Parents' mood is worse, young children's behavior is worse. Parents are feeling more stressed and are more likely to be irritable and lose their temper. So the kind of ongoing daily strains, especially around care and school, have been particularly difficult to handle throughout the fall as the pandemic has persisted.
Absolutely, thank you. And I think any parent who has had a child whose internet went out during a lesson can certainly identify with the strain that that brings to everybody. Professor Plum-Villodaga, I'd like to come on to you now. You work directly with people who are struggling with substance use disorder. What is your experience seeing patients revealed about how the pandemic has affected people who were already struggling with these issues?
Well, it's affected people in two ways, right? So everything we've been saying about this as a chronic stressor, it's affecting every area of our lives. For folks who already had difficulty managing a substance use disorder, in the very beginning of the pandemic, everything shut down, including care, because we didn't know how to do that safely. Now we've learned a lot and clinics are opening back up, but this chronic stress is really making substance use recovery harder. We're also seeing individuals who are struggling with a new substance use problem. So all of these stressors about everybody in the household is stressed out, whether they're worried about finances or also worrying about school, or an elder parent who perhaps is no longer in a at-home facility, no longer in a nursing facility, but maybe at home. There's a lot of levels at which stress is happening, and all of the ways in which we would normally seek to combat a substance use issue and improve our mental health, those are all limited, even though we know that access to professional care is opening back up in safe ways, both in person and virtually. People are still feeling like the alternatives to use are limited, the stressors persist, and it's very difficult to find positive social support because even when we reach out to others, everyone is stressed. So it's really making it a challenge for people to meet their recovery goals. And a lot of parents and adults are really struggling with how to turn their attentions towards healthier behaviors to cope when it's very easy to numb out with substances, and it's very easy to isolate because we are asked to isolate. We're choosing to isolate for another safety reason. So these things all make it more difficult. But I do want to give people hope that recovery is possible. We have to work a little harder to engage in alternative behaviors to substance use and improve our mental health, but it is possible. And even right now, virtual options for treatment are available if you're afraid to do in person, although everyone has put COVID safety protocols and many clinics are seeing folks in person in very safe ways. But there are free resources available. Peer support has maintained a presence for folks, and peer support can be a powerful intervention for people to help get a sense of recovery and create a community where recovery is possible. So peer support can look like a 12-step program like AA or Narcotics Anonymous. Families can still seek support with Al-Anon. And then there's also Smart Recovery, which is another peer support program that's free and has been virtual. And there are many of these groups that are meeting virtually throughout the Triangle.
Splendid. Thank you so much. And thank you to all of our panelists for those opening answers. Certainly there is a lot to talk about here and we will get through as much as we can. Now we will open it up to questions. Thanks to everyone who submitted questions in advance. You can pose questions via the Q&A window at any time and I can ask them out loud. If you would like to ask a question in person, raise your hand in Zoom and we will unmute you when your turn comes around. If you're calling in by phone, you can raise your hand by pressing *9. Thanks also to everyone watching this on YouTube. Feel free to like and subscribe if you want to see future briefings. Okay, so we're going to get into some questions that we've already had here. And regardless of who I direct the question to, I welcome input from all panelists on this. Professor 𝐏𝐻𝐬, I'd like to come back to you to this notion of cumulative stress. There are lots of individual stressors that we can identify right now, whether it's the strain of parenting or economic strain from being out of work. But of course, the trouble with stress is that they're not in individual buckets, right? There's a cumulative nature of this stress. And how much of an issue is that with the pandemic that is creating so much stresses on its own?
Sure. You know, I absolutely adore Kelly Clarkson. I think she's fantastic, but she got it so very wrong. What doesn't kill you doesn't make you stronger. What we know is that the more stressors, the more traumas, the more difficulties that we have puts us at greater and greater risk for both short-term and long-term challenges. So when we are thinking about families, particularly with children, we're seeing increases in anxiety, depression, as was mentioned, substance use. Those traumas are cumulative. And so what we will see when children are stressed out, when parents are stressed out, particularly young children, it comes out in behavior problems. And so as behavior problems increase and family stressors increase, it becomes the pot is boiling. The pot is boiling and it is boiling over. we know from long studies and longitudinal studies, the more stressors you have, the more at risk you are, we would imagine, and understand that it's more mental health concerns. But we also know from the research, more at risk for health problems, more at risk for homelessness, more at risk for unemployment, more at risk for health problems like cancer, diabetes, that don't seem like they should be related to stressors from childhood, but that's what we've seen. So we truly do need to make sure that we appreciate the cumulative nature of stressors and recognize that we need to, it's not carved in stone. We can get in and do something. But I'll tell you, one of the biggest challenges that has happened with the pandemic is the availability of mental health services juxtaposed to the need for mental health services is quite out of balance, completely out of balance right now.
Absolutely. I'm glad you brought that up, and I want to dig into that with all three of you. But for the moment, Professor Ghasman-Pines, I want to come back to you with this notion of cumulative stress. You've mentioned that you're getting ready to do another survey, but with the longitudinal data you already have, do you see a curve where you're kind of able to anticipate, or there are things that you fear you're going to find in your next survey in terms of the effect of the cumulative economic and emotional stress on the parents that you've been surveying? I mean, what do you think we could be seeing over the next few months?
Well, that's right. And it's a really important point because the pandemic has a heightened health risk. It has also had tremendous economic impact for families. And it has changed so many things about family life that we, in our prior work, have already seen that when families experience an accumulation of stressors related to the pandemic, like an adult in the household having been laid off, like that family having experienced a substantial loss of income as a result, like someone in the family having been ill or having increased caregiving burden. When those accumulate in families, that is really when we see the absolute highest levels of mental health problems for both parents and the young children in those families. And that is exactly the kind of thing that we're going to be looking at going forward. Both how are these stressors continuing to accumulate in terms of both health effects of the pandemic, disrupted schooling and care for children, and families' economic well-being. We're also hopeful that as we continue to follow these families, eventually we will be surveying them at a time of recovery. So speaking to Dr. Gurwich's earlier point about kind of straddling this line right now, we're going to continue to follow these families, and hopefully we'll be able to see a time when the number of stressors that families are experiencing starts to decline.
And I would add to the list that Dr. Ghasman-Pines just listed, grief. We have tremendous grief happening in this country. That is a unique stressor. Children are experiencing grief in ways that are unprecedented. Families are experiencing grief, and that is another stressor that we add to the mix. And then if that weren't enough, let's just add a few disasters, wildfires out in California, massive ice and snowstorms in the Midwest and in the Northeast. So all of these stressors, it's not just COVID, and then throw in the racial disparities for services. And again, to your point, Greg, those cumulative stressors are building and building and building.
Yes, thank you. And before we move on from that topic, Professor Plum-Villadara, I wanted to ask you, to what extent do you think that we could be, without wishing to overstate the point, be on the precipice of a coming crisis, in that these cumulative stressors seem bound to result in an increased amount of substance use disorder? How concerned are you that people who aren't currently in treatment for recovery might soon need to be, because these problems are going to cause them to go down that road?
That's a great point. I am concerned. people have estimated that not just the mental health impact of this pandemic, but also the substance use impact of this pandemic will persist for years afterwards because of the lack of access to resources. As Dr. 𝐸𝐻𝐸 mentioned, the need far outweighs what we have to offer in terms of professional support. And also there's an additional piece of the COVID pandemic itself interacting with substance use. So substance use, particularly substances, actually puts people at increased risk for infection of COVID and increased complications from even death from COVID infection. So we know that there's a huge problem with the increase in use of substances because it actually is a huge risk factor for staying alive through this pandemic and seeing our way through to the other side. And the fact that there is systemically lack of access to affordable resources for people to access mental health care, professional substance use training and counseling, and even effective treatments. We have them, we know what they are, but getting people to them, getting people to places where they can afford them is difficult. So there is a coming crisis. It's here. Early on in the pandemic, there were higher rates of overdoses from opiates. It's hard to know where that data is now because that data takes a while to collect, but there was a huge concern about that. So I think that this cumulative stress will build, not to mention the lingering effects of the grief, as Dr. 𝐸𝐻𝐸 mentioned, of all of these missed milestones, students who weren't able to graduate from a level of school or college or high school, family members passing and not being able to have funerals or to honor their passing in the way that we might normally do. So all of these will persist because those anniversaries will come. We'll have missed out on many, many, many important milestones. So it is a crisis and it will persist. So we need more resources to support people.
Thank you. I'm glad you brought up the notion of resources because I want to talk a bit more about that. But for the moment, we have a question in the Q&A. And Professor 𝐸𝐻𝐸, I'll direct this to you. And it says, what impact, do we know what impact stress has had on children's academic performance? And is this going to end up being considered a lost year for many students?
Well, I think that's a question that we're all struggling with. I think it's important to take a long lens look that what happened in this past year doesn't define where kids or teens are going to be in the long term. So we still have that potential, but has this disrupted education? Absolutely. And I think it has really brought up the disparities even more for families that did not have access to reliable internet, or for families that had children in special education services, which were incredibly derailed during this last year. We certainly know that those children are at much higher risk for not meeting those academic milestones. So we do know it's not just the academics, it's also the social emotional piece that we have in school. It is the nutrition that they get in school. So there are so many more layers to education than simply your ABCs, math and science. For some children, they've actually been able to do fairly well. For other children, virtual learning has been a very much an added stressor. And for some children that were doing great in person and then virtually, they couldn't make the transition and their grades slipped. It has effects on their self-esteem. It affects their view of their own future. So I don't want to say, gosh, this is a lost year, we should write it off, because I think that there are things we can learn from this, but it certainly has put in more challenges. And I will say along those lines, we need to do a little bit better. I've been beating the gong as much as I can that we have to give our educators tools that they need to help children, no matter whether it's virtual or in person, to connect with them in a way that learning happens, because right now there is great stressors. And as a friend of mine said just this morning, she's already done 3rd grade and she is having to redo 3rd grade because her child gets so worried about what's happening. And so she's having to figure out how to do a work-life balance. And some of our families, like the ones that are being studied that have to go to work, that can't be there to oversee 3rd grade lessons or to be there when their child comes home if it's in person, we're seeing many, many issues. So long way around that answer. I do think that this has served as a year of disrupted education. I don't want to say that this is a lost year of education.
Sure, thank you. And anecdotally, as a parent of a son who with special needs who's been super attentive during online lessons and a teenage daughter who wants to do all of her lessons in bed and maybe not all of her lessons, I can totally understand where you're coming from. Every child is indeed different. Hopefully that answered the question. I want to come back now to this notion of resources and what's needed. And Professor 𝐏𝐬𝐪, I'd like to start with you. There's a lot of discussion at the moment about the stimulus package that is hopefully getting ready to be going out. Do you have any sense from whether it's going to contain some of the things that the families that you've talked to most need, and what do you think could make the most difference to alleviating some of the emotional mental stress on the families that you've talked to?
Right. So really what families, lower income families need right now is more money. It in some ways is actually quite straightforward. Early on in the pandemic, when we asked folks about economic stresses and strains, what they told us is that by losing jobs or keeping jobs but having fewer hours, they were experiencing substantial income loss, and that was affecting their ability to cover the basics, like many families worrying about being able to pay their rent, many families being quite worried about having enough food. So these are really families who are struggling to just cover the basics, even through the fall. Nearly half of our families told us that they were worried about having enough money for food. That is a very high level of food insecurity. And the way to relieve those economic stressors is to find ways to get more cash to those families, more money that they can use to cover the basics. So what we know from earlier in the summer is actually that first round of stimulus really did help. We found this in our own work when we surveyed families in summer. Through the CARES Act and the one-time stimulus checks that went out, as well as the expanded unemployment insurance compensation that reached many laid off workers, that really buffered families from the most severe income losses and the most severe economic stresses. But of course, those were temporary. And so by fall, when those CARE Act provisions had largely lapsed, families were once again experiencing quite high levels of income loss and resultant strains. So if the government can pass another round of stimulus checks to get those checks out to families, that will make a tremendous difference right away, especially for our most vulnerable families who really need those resources to cover the basics.
Absolutely, thank you. Professor Plum-Villardaga and Professor 𝐏𝐬𝐪, I'd like to get your input on this as well. You've both talked about the need for more resources in mental health. You know, the stimulus package, obviously funding for individual families is so important, but we know that mental health struggles are often invisible, they're not seen, and they don't get the attention that they deserve. What are some of the things that you think could be done at a federal or state level that are needed to support mental health professionals and provide more capacity to deal with this crisis that we're in? And Professor Plum-Villardaga, please go ahead.
I think there's a lot that can be done at a larger level. The first thing is right now I've seen that telehealth is a great option for folks, for families, because I've seen increase in engagement and care from telehealth. And so being able to support third-party payers, insurance companies, Medicare, Medicaid, actually paying for telehealth and paying at parity so that providers can continue to offer telehealth services and maintain their practices. Those are important features because telehealth increases engagement. Because think about this, you don't have to drive to an appointment. You don't have to take an entire afternoon off from work. I have families who are able to put a child in front of a television program for 30 or 45 minutes, and that's okay so that they can talk to me. So it really increases engagement and care. Also being able to have financial support for substance use and mental health treatment. That needs to be taken seriously. As people's stressors increase, the level of substance use care that folks may need may actually be more intensive, maybe a few times a week, a more intensive program. So having some flexibility with the ability for people to take perhaps FMLA or other features to be able to give them the care that they need to establish and maintain recovery, to keep them engaged in employment, to keep our economy moving forward. I think those things could be incredibly helpful.
I would underscore what she has said with a big highlighters and markers and everything else. We truly have learned a lot about our pivot into telehealth and the benefits of having that resource, but it has to be covered and it truly needs to be expanded. Along with that, I think we still need to work on campaigns to reduce stigma, particularly in minority populations, around accessing mental health, and look at it right now as this would be expected, it would be normal. And so there's nothing, quote, wrong with you if you think that you may benefit from it. And finally, I really do believe that we need to do a better job training our mental health providers. One, increasing the numbers. We do not have enough to deal with the current as well as the long term, which is going to be much greater need for mental health services. But I think we really need to do a better job training our providers in trauma-informed care and trauma-informed services, how to recognize what this has been like for families, taking that trauma-informed lens, and it's not always something that you get in graduate school. So we need to do a better job educating our upcoming providers as well as our current providers in areas, whether it's substance use, whether it's family stressors, whether it's specific issues to children. Improving a trauma-informed lens can be very helpful as we look down the road for mental health services and needs.
And I just want to add to that, Dr. Ghorevich, you were mentioning the importance of training our providers and stigma. And I want to echo, stigma is a huge problem with accessing substance use treatment in particular, right? It's often stigmatized on the individual level, family level, cultural level, across cultural groups. It has different stigma levels. So the more that providers can be trained in offering care, the more general we can get substance use and trauma-informed care into our training programs to give people those opportunities to speak to those issues. Someone may not seek specialty care for substance use, but may need it, but might be more likely to talk about grief or stress. And so if we can think about entries to care, even at the primary care level, maybe having integrated services with folks who are seeing their primary care providers or perhaps going back to the primary care provider for the first time in a year, to be able to reduce that stigma, and also to reduce that stigma and to encourage engagement from folks who are bearing a disproportionate burden of this stress. As Dr. Ghorevich has mentioned several times, healthcare disparities are extremely prevalent in mental health, and they're extremely prevalent in substance use treatment. That has persisted and even worsened in COVID. So the more we can encourage people to be educated and to recognize that these pieces are important and they can be accessible, we need more providers to provide that care as we reduce the stigma.
And I think if we look, you asked me about education before, so I'll circle back to that. Sometimes in school systems, you may have one mental health provider for thousands of students. That's not going to work. Anybody, even basic math, would see that this is an equation that is not going to work. And so we have to think about, as we look ahead, of how do we help schools get children back into the learning environment? How do we help them access and recover some of the things they may have lost over the last year? We also have to look at mental health providers how are we going to do that in schools? How do we make sure that there are services to reach the children's needs in a school setting? That's one of the big problems with school shutdowns is many children access those services in schools and they went without for quite a long time.
Thank you both for that. Before we move on, I'm interested in asking again about this notion of building capacity, because clearly there isn't the capacity of mental health providers to deal with the scale of the problem. But to get there, how much of that is just individual universities doing more to recruit? How much of it can be solved or helped with federal funding? What can we actually do over the course of the next generation to build the necessary capacity to cope with the level of need in the country, do you think?
I'll jump in. I think it's across the board. I think it needs to start in our graduate programs. We need to really have more information in graduate school about how to address trauma and stress, how to address special issues like substance use, like disparities, the intersectionality of all of these things, grief and loss, that needs to be attended to a little bit more in our graduate education, but I think also in our professional education. Every profession in mental health has to receive continuing education credits. And so how do we make sure that the programs that states run, that our national organizations run, incorporate these issues for our providers so that if they're there, they can be accessed? I am part of the National Child Traumatic Stress Network, and there are many free trainings for professionals dealing with children who've experienced trauma and stress that both lay people as well as mental health can access. So I think there are, as was said before, there are great treatments available. There are amazing evidence-based treatments available, but there are also really good prevention treatments. There are really good interventions that can be delivered by anybody, by the people sitting in the audience today can learn how to deliver some of these services. So we just need to tap into the resources, but definitely they need to be not only at the graduate level and the postdoctoral level, but also into the professional development level.
And I would add to those fantastic points that another way that we can actually increase access to care is to continue telehealth. There have been a number of things that have been happening more nationally that I think can support that. Psychologists are now able to apply for telehealth licensure across state lines, which is a huge benefit. So in addition to adding our numbers, increasing our numbers for therapists, this is a way that we can start to begin to access care, because what ends up happening is you train up professional counselors. They tend to cluster in urban areas around academic centers, and it's hard to get care where people need it most, perhaps in more rural areas. There were some incentives in the past in different administrations where folks perhaps working in the Veterans Administration, for example, there were incentives to reduce your loans for going to graduate school if you went and worked in a more rural VA hospital for a number of years. There are loan repayment programs that if you're doing research, and we can incentivize those to say, if you're doing research on trauma-informed care, on prevention, on reducing stigma and access to care, on increasing access to care in underserved communities, we can incentivize those programs to help people do the work that's needed where it's needed and to reach people with even the providers we have. So there are a number of ways we can bring resources where they're needed, and telehealth is one of those, and incentivizing providers to both provide resources and to do research in those areas to increase awareness of the problems and provide solutions that are sustainable and implementable.
Absolutely, thank you. Before we move on from this notion of access, Professor 𝐏𝐻𝐻𝐸𝐪, I know your survey began before the pandemic hit, but have you been able to glean any sense from your participants as to whether they've, because clearly the stress is there, whether they've been able to seek mental health care or whether access has been an issue? Have you been able to touch on that?
So we don't ask specifically about access, but what I can underscore is just the tremendous amount of need. So we have given everyone in our sample screeners for major depression and generalized anxiety, and half of the parents in our sample are screening positive for either depression, anxiety, or both. And so I think that really just underscores the tremendous need. This is largely a sample that is people of color. So again, to highlight especially racial disparities in who has been experiencing the largest impact from the pandemic, to just really underscore that people of color who are more likely to have lost access to work, who are feeling greater economic strain from the pandemic, who are also feeling and are more strongly affected by COVID itself, both for their own health, but also people in their families or their social networks, and that these are, again, accumulating and really leading to a tremendous amount of need for mental health supports and services.
And if I could piggyback on that, we know from research that one of the best predictors of how well our children are doing or will do is how well their parents and caregivers are doing. So when we look at that kind of data, that our caregivers are truly struggling, then one of the best predictors and one of the best ways to help children cope is being compromised. And so we are seeing parallel increases in depression, anxiety, behavior problems, school challenges, substance abuse, suicide ideation in children and teens. And so I really do believe we have to take a family and a community, the village approach to how do we help move forward.
Absolutely. Thank you both. Right now, I'd like to zero in a little bit on a particular concern, which is opioids and the opioid epidemic and opioids in the home. And Professor Plum-Villardaga, I'm wondering if you can give some advice for families that might be concerned about opioids in the home and the potential for their misuse.
Yeah. Opioids are a huge problem, and they are accessible, and they are problems that we see across every segment of the population. One of the things I would say that's the easiest thing you can do is reduce access. So if someone had a surgery, a tooth extraction, put away the opiates, get rid of them. You can look online. Most pharmacies will take back your old opiates. So one easy way to reduce risk is don't have it available in the home. Now, that doesn't mean that there aren't many other ways that individuals can find access to opiates. Unfortunately, we've seen people turning towards more harmful ways to use opiates when they have created tolerance for opiates and they're seeking it on the streets. But there are ways that you can prevent access to it at home. Don't keep old prescriptions in your house. That's a simple one. If someone in your house is struggling with an opiate use disorder, know that there are actually fairly simple alternatives that can be used for treatment. So even if a person may ideally need a residential treatment program and may not have access to it, one simple treatment that is very, very effective is an opiate replacement therapy that more and more prescribers, even some primary care providers, can become trained to give. If not, a psychiatrist can prescribe it. And opiate replacement therapies provide an opportunity for people to become stable from an opiate use disorder and to be able to have a full recovery lifestyle. And so that looks like Suboxone or buprenorphine, and you can ask providers if they're willing and able to prescribe that for you. And that is a really great way to start your recovery. If you need additional support, and you will, find social support who is sober or clean. That's extremely hard to do in a pandemic, but as I've said before, peer support is better than nothing, and they are virtual and online. So peer support is a great place to go. Also for families, I really want to echo what Dr. 𝐏𝐚𝐧𝐞 said, is that family treatment is a helpful use of ways to promote a community, a support network. So family supports are incredibly helpful. And even if you know you have someone in your family who is seeking support for an opiate problem, and they're actually seeking treatment, or you know they're working on it, or even if you're just worried that they're not, you can actually get access to a life-saving treatment. Anyone can use it, naloxone. It is a opiate blocker, so it can reverse an overdose. And many pharmacies, at least in North Carolina, and this differs across states, you can get it in other places and other locations in other states. You can get this opportunity to save someone's life if they're in an opiate overdose. It is what the EMTs would give your loved one if they came to the house to save their life. If you use it, it's like an EpiPen in most ways of delivering it, and then call 911 to get support, because your family member may still need medical intervention to make sure they're safe after that. But that is a way to save lives. This is a harm reduction approach that can give your loved one another opportunity to engage in recovery. And what we know about recovery is it's not linear. People have slips. They need to return to recovery-oriented resources perhaps many times before recovery becomes a habit. And so I just want to encourage people to know there are accessible treatments that are very effective and can save the life of your loved one.
Thank you very much. Professor 𝐏𝐤𝐬𝐬𝐬, I wanted to come back to you because you mentioned earlier about things that families can do at home to help one another out. Are there any kind of examples that you can give? Because it's easy to feel lost when you're in a stressed situation with other people who are stressed and you're not trying to cope with these things. But as you mentioned, there are some simple tools. Are there any that you can throw out there that could help people?
Sure. I'll give a couple of thoughts, and then others can weigh in. I can't stress enough the importance of routine to help reduce stress. And in the pandemic, that has been a very hard thing to develop and to maintain. That doesn't mean at 6 o'clock we have to do this and at 6:30 we do that, but just a routine, thinking about what does our day look like? Because routine allows us to feel more in control, to feel that things are more predictable. I know what's coming. So how do families set up routine? Within that routine, there also needs to be time for each family member to have some quiet alone time. That's also very important. I know that's easier said than done, but if it's built in, and families can even have a say in what they would want to do during that time, that can be helpful. To think about how are we taking care of ourselves, whether it is taking a walk, playing with a pet. We know petting an animal reduces our blood pressure, so find your pet and pet it. We can look at that. Getting up and moving, activity and exercise helps. So that is there. I think it's also important to maintain open communication within family members. So for families to check in with their kids, this has been going on for a while. How are you doing? What is this like for you? And for teens that say, I'm not going to talk to you, then ask it differently. How are your friends doing? What are your friends saying? Because I'll tell you all day long about my friends, because that's not about me, but we all know we have friends because they think the same way we do. So how can we help make sure that we are going back to those conversations? I think it also is important when we think about grief. If families have lost a loved one, and there are certainly, over 500,000 families with empty chairs and extended families, together, how can we think about honoring the memory of the loved ones? That can help. And I'll give one more, and then I'll be quiet because the list goes on and on. But we know also that even when we're stressed as much as we may be, if we can find a way to help someone else, we do better. So can we think about how can we help someone else? So maybe if I'm struggling, I still may volunteer time at a food bank. Even if I'm struggling, I may help my neighbor shovel their snowy driveway. Even if I'm struggling, I may, write an old-fashioned letter to family members so they feel connected in a different way. So there are so many ways that we know that can help. Over time, I'm going to stop there because otherwise I'm going to take up all our time that we have left.
That is quite all right. And thank you, not least, for validating my decision to eat the same cereal every morning, because it gives me control over my breakfast. I'm going to stay with you, Professor 𝐏𝐬𝐬𝐬𝑚, because we've had a question in the Q&A related to schools and children. And it says that it's unclear how public schools will solve the issue of mental health in schools, given the rise of needs and what teachers are seeing in students. It mentions that in Georgia, for example, they have on average one school counsellor per 466 students. This is obviously a huge amount in decline, but how can this be addressed? Is it a simple matter of federal and state funding, or is there more to that?
I think it'd be great if we had more money for mental health. That truly does help, as has been said by our other panelists. But I think it's also looking at, are there programs that we can put in place that truly don't cost a lot? For example, colleagues that I work with have been working in the Chicago inner city high schools, providing training to educators on a preventative universal level, that everybody doesn't have to go see the school counselor, but the teachers, just by using the skills that they're being taught, can implement in a classroom. And they're seeing great gains for very high-risk youth. So we know that there are ways that we can expand the reach simply by helping our educators develop skills that don't take away from their classroom, that doesn't take away from their classroom instruction at all, but they can incorporate into their lessons and just how do they interact with students that can change outcomes. We also know that there are other services, for example, Communities in Schools works with community stakeholders to increase the number of providers in the schools that don't take from the school budget, but actually are tapping into stakeholders in the community. So there are many ways other than just adding another warm body, although adding more warm bodies cannot be underscored. We need more counselors. The person in Georgia, you're right. It is ridiculous to think that one person can actually take care of the needs of 400 students all by him or herself. But I think it's a combination of opportunities that we need to address. And sorry about my cat popping in.
Absolutely, that's fine. And there it disappears into the virtual background. And certainly, one of my best friends is an elementary school psychologist, and I think he would be delighted to have more warm bodies in his school. So you're right, certainly that's one of the ways we approach this. We are moving towards time here. Before we end, I'm going to ask each of you this last question on this idea of hope. The things that either give you hope or the things that can give people hope. Professor 𝐏𝐬𝐬𝐬𝑚, I'll come back to you. Obviously, your most recent survey was in the fall. You're getting ready to do another one. Do you have any sense that maybe the vaccine rollout would give your families hope, or have you asked them about the things that they need or any reasons they might have for optimism? So we'll start with you.
Sure. So many of the parents in our sample are working, and largely in what we've now been calling essential jobs, particularly in food service and grocery stores, in pharmacies. And as we move forward, for example, here in North Carolina, essential workers are next on the list to get vaccines. That's happening around the country as more vaccines are getting approved and access is increasing. Essential workers are going to be able to get access to that tool to help keep them safe. That also hopefully will be keeping their families safe as well. And I think also there is room for optimism around the policy response. We don't yet know what this additional bill will look like in its final form and what will be able to get passed. But I do think just to highlight and underscore the fact that these stimulus measures, getting stimulus checks to families, making unemployment insurance more generous during this period of real crisis will really support families' needs during this time. And I think there's a lot of reason to be hopeful around the current policy response that's being debated.
Absolutely. Thank you. Professor Plum-Villadagher, it feels unfair to go to somebody who works with people suffering from substance abuse disorder to talk about hope, but what gives you hope and what do you think can give people hope?
Well, I'd like to say that in mental health and substance use work, you have to have hope or you wouldn't do this work. And so I have long been amazed by the resilience of the human spirit, right? And so while there's a lot stacked against us when when folks have been exposed to chronic stressors, multiple traumas, both individually and families, cultural, oppression traumas, that there is resilience. And one of the things that I've seen emerging from the pandemic is we're all looking at what actually matters to us. We're letting go of some of the things that perhaps we weren't attending to when we were busy and paying more attention to, if we had the resources, what would we actually spend our time doing? And so, as people are able to feed their families, maybe we can have people return to that natural inclination to say, what is actually most important? What do we need to talk about as a family? What helps us grow? What helps us feel connected? And so I think those conversations that unfortunately and fortunately children are learning to have, and hopefully our parents and adults are learning to have with one another, I have hope that we can create communities that support one another and truly do some of that preventive work that Dr. 𝐏𝐻𝐧 has been talking about, where we can create communities that support one another in growing and being able to use principles of health in our daily interactions. So I'm hopeful for that. I'm also hopeful that people have chosen to engage in recovery, even in a pandemic. Some have said, why bother to change something that gives me comfort, even in the short term now? But even more others have said, I have nothing better else to do except work on myself. So let's do this, right? So actually, in some ways, some people are using the isolation as an opportunity to say, I don't have to worry about feeling stressed at work when I have a little bit more containment at home. Let me work on my drinking. Let me see if I can cut that down. Let me actually walk more, even if it's outside. Let me actually get healthier. So there is hope because I think we're changing our culture and our community orientation through this pandemic, recognizing how much it's important to us and that people are choosing to be healthier and take those steps even as they're difficult in a pandemic.
Thank you so much. Professor 𝐏𝐬𝐬𝐬.
Sure, I would agree. We go into mental health because we truly believe in hope and the possibility of things being different. I am very, very hopeful for our future. Not completely Pollyanna that I don't recognize all the hills to climb, as you mentioned, Greg. But I really do think that this is an opportunity that we have had, unlike any other time that in my lifetime, and trust me, I'm an AARP member, that we have opportunities to teach our children some values, some ideals and beliefs that may move us forward into a more hopeful place. I truly believe that, our hope anyway, that we will come out of this as we continue to evolve as a kinder country, that we can recognize how do we treat each other, what values do we want to instill in our children moving forward about how others deserve to be treated and what our role is in how we treat others, and how we advocate for others. So I truly do think that there are opportunities for growth. There's opportunities for hope, that we will be a kinder and maybe a more connected. We will recognize and be grateful for things that we weren't in the past as we move forward. And I'd like to take one note for all the people out there to recognize that this is a unique time for those in the media too. You are not separate from these stories. You are part of the stories in a way that's very, very different. Many of you are probably doing third grade work while you're trying to write stories or attend this kind of webinar or many other things. So stressors for our media colleagues are higher now than in many other times. And so the stressors and the risk factors for you are there too, particularly as you hear those stories. So being hopeful and thinking about how do you blend as you cover these stories, that grain of hope and moving forward, not only for yourselves to take to for you and your family, but as you carry it forward and share it with others. So I will stop there.
Well, thank you. I always appreciate a shout out to journalists as a former one myself, and I think kindness is the perfect place to stop. So thank you to our panelists, Anna Gassman-Pines, Robin Gerwich, and Jennifer Plum Villadaga for sharing your perspectives. Next week, we'll be discussing what scientists have learned about disease transmission from animals to humans and why that's important to preventing future pandemics. But if you can't wait that long, in the meantime, we'll be talking to Professor Sandy Darity tomorrow at 11 about wealth disparities caused by racial inequity in this country and what should be done to address it. If you'd like to be notified about that and upcoming briefings, please email dukenews@duke.edu. In the meantime, I hope today has reminded all of us that it's okay to struggle. Everyone is struggling because to struggle is human and there is always hope. Thank you everyone for joining us. Please stay well, wear a mask, get vaccinated when your turn comes. Now go